This is Connie Chung Tonight. From the CNN Broadcast Center in New York, Connie Chung.
Good evening. You know, it wasn't so long ago it was considered rude to talk about cancer, but that's been changing. It's relatively recently that people have talked openly about prostate cancer. People ranging from Yankees manager Joe Torre to former New York Mayor Rudy Giuliani, Nation of Islam leader Louis Farrakhan, Senator and presidential hopeful John Kerry, and a previous presidential hopeful, Bob Dole. Now, another famous figure has joined their ranks after beating prostate cancer, spreading the word that no one can consider himself immune. It's Pat Robertson, host of the 700 Club and founder of the Christian Coalition, who joins us tonight from Virginia Beach to talk about his recent surgery and his new book, Bring It On. Well, good evening, Mr. Robertson. You know, I have to tell you, you look terrific.
Well, Connie, I feel terrific. I am one happy guy. You know, I had that offending organ out of my body, and my surgery was just 10 days ago, and I was on the air 7 days after surgery.
Well, that's the amazing part. I'll bet the doctors were just bowled over that you came back to work so quickly.
Well, I'm very blessed, but you know, I found this Israeli-born doctor named Arnon Krongrad down in Miami, and he did the first one of these what they call laparoscopic radical prostatectomies only in 1999. So I was sort of a guinea pig on this, but it's been a wonderful operation. Very little blood loss, and it's just tremendous. I can't. You know, I thank him, and I thank the Lord for sparing me.
Well, absolutely. Take us back to the day that you were told that you had prostate cancer. I think it was the day after Christmas.
That's not exactly the way you want it. You want to wrap up the presents and the turkey, you know. The day after Christmas, I went to see the urologist. He said, I have sort of bad news for you. You have a Gleason 7 on a scale of 10, a Gleason 7 cancer. And he found that essentially every sample he took had cancer in it.
Mm-hmm. And your wife was with you at the time?
She is a former assistant professor of nursing, and she is a great support. You know, and they really want wives to do this because this affects the marital relation quite a bit, you know, so as husband and wife need to go into it.
Your brother died of prostate cancer, so were you, you know, forewarned in some way that you might have to watch your PSA tests?
Well, I've been having the PSA right along, and I thought I was really healthy because I am very strict on diet. I take all kinds of vitamins and supplements. I lift weights. I exercise. And this gives you no clue at all, but he had radiation, and I was there at his deathbed and then performed the funeral ceremony, and I knew I wasn't about to play with this thing. It was deadly, and if I didn't deal with it, it was going to kill me.
So that's why you chose surgery?
Exactly. I had no choice. The doctor, I said, what would you recommend? He said, well, if you were 60, I'd say surgery. I said, well, basically, let's believe I'm 60 because I'm going for surgery.
Will you tell us how old you are?
Well, I'm 72. I'll be 73 in another few weeks.
So there were no symptoms. Is that right?
None. Connie, I was lifting big weights. I mean, the 1st of February, I hit a new record on an incline bench press at 2,000 pounds, and I thought I was really a he-man, and I didn't have any symptoms that I could tell at all. I was perfectly healthy.
You are so marvelously open about this. Was there any time when you thought to yourself, no, this is too private, I'm going to keep it to myself?
Oh, exactly. The minute I heard it, I said, look, we're not going to let this thing out. And I remember I shared it with some of the key staff members here at CBN, but I said, look, we're going to keep this thing quiet until we know exactly what we're going to do. But a couple of days before I went for the surgery, I told the audience, I said, it's time to let the American people and our friends know what's going on so that they'll be supportive and understand what's happening. But I wanted to keep it quiet. But my family knew when they all gathered around me. It was a wonderful thing. When I got that report, I had my children, my grandchildren, and they all volunteered. They said, look, we want to come and surround you and pray for you. It was one of the most touching things of my entire life to have that happen.
Oh, that's